Focus is a program of education and information. The name of the program this evening is Careers in Dentistry, and co-hosting this evening is Shelley, and thank you all for joining me this evening. I usually like my guests to introduce themselves. This way I don't mispronounce their name, so please.
Okay. I'm Dr. Mary Nasso. My partner, Dr. Napolitano, is with me here today. We have a general dentistry practice in Eltingville and Staten Island. I founded the practice 31 years ago, approximately, and I love what I do, and I'm happy to be here today to share with young people what a career in dentistry can offer them.
So here's a question that surfaced, thinking about, where are we going with this show and the direction. So there are different types of dentists. Why don't we start with that?
Well, like Dr. Nasso said, we're general dentists, so we pretty much do everything. We see children, we see adults, obviously, we see the elderly, we do cosmetics, we do implants, restorations. So we run the gamut. So there are other specialties such as root canal specialists, oral surgeons, orthodontics, the orthodontists that are out there. We do orthodontics as well. We do the Invisalign program. But that's what makes dentistry so interesting for us,
So let's step back for a moment. Education-wise, all of these different branches of dentistry goes through the same learning experience, it's the same educational path, and then somehow specializes in the other areas?
Right.
How is that handled?
So the first thing is a degree from a dental school, and that's usually a 4-year program after college. And then now the requirement is, which has changed, I believe it's a 1-year residency, and then you can apply to specialty programs. And there are specialty programs in pedodontics, which is treating children, periodontics, which is treatment of the gums and implant placement, oral surgery, which encompasses implants, extractions, treating fractures, treating congenital malformations, endodontics, root canal, prosthodontics is another specialty, complicated, restorative. Have I missed anything? Public health.
How do you pick the specialty? How do you know, I'm going to like this, I'm not going to like that?
Well, we like it all, and that's why
Right,
we're general
that's why you're
dentists.
general.
Just like, you go through college and you're trying to figure out what you want to do, or even high school, starting that young. In dental school, you get a taste of every specialty. And, once you find one that you like, or if you like them all, you become a general dentist. If you like one, then you can apply to a specialty program.
So in the audience as well are students from the pre-med club. And they have an interest, obviously, in dentistry. And we're going to field some questions from them a little bit later. But give me an idea of the foundation. Do you have to be strong in math and science in order to be a dentist? Do you have to be an artist? Because, you're working on teeth.
It's a great question.
Exactly.
It is. I mean, now more than ever, we see, because I have friends who teach it at the schools, students coming from college that have an English major or a music major. So dentistry is an amazing field where you have to be good in the sciences, obviously, and like the sciences. But there's so much perception and artistry involved in it that you can be an English major and try to get into dental school. It's a great thing.
I was a psychology major.
Okay.
So that was my major, and it was a little challenging while fulfilling all of those requirements to take all the math and science that I needed, but I did it. So instead of perhaps taking an art course to fill in some time, I took my chemistry and my physics and my calculus, and all of my free classes were in those subjects so that I could meet the requirements for dental school. So it's very possible to do that.
So you need to take a test in order to get into dental school, and part of that test, you have chemistry, biology. What else do you have on that test? Is it organic as well? Organic chemistry. So you need to take those.
Physics.
Yeah, physics. You need to take those courses, obviously, in college before you take the dental entrance exam.
Shelley, are you interested in medicine?
I am. I'm interested in medicine. I don't know what field yet. But I have a question. Once you've taken the exam, you got your good grade, you've done your undergrad, is there any kind of volunteer work or any kind of internships that you would recommend, or something that students could do to give them an edge in the application process?
Well, I mean, what started me before I took the dental exam, and I figured out what I wanted to do. I was pre-med, and I went to Fordham University. But I didn't really have a career path. I knew I wanted the health sciences, but I didn't know if I wanted medicine or pharmaceuticals or physical therapy. But what got me into dentistry wasn't an internship, but it was just contacting my local dentist and said, listen, I'm interested in this field. I'm also interested in other fields, but can I shadow you for a day to see what it's like? Because that's really, firsthand experience is really the best experience that you can get to see if you actually like to do it.
So it's wonderful to have that kind of working experience. And I started working for my family dentist at 16. And after 6 months, I decided that this is what I wanted to do with my life. So that was a wonderful opportunity for me. But to answer your other question about is there anything you can do to prepare, any opportunity where you can volunteer I think is good. And it's been so long ago, I can't quite remember if it was in high school or college, but I put together a program in teaching, I have a feeling it was in college, teaching developmentally disabled children oral hygiene. And I went into the classrooms with toothbrushes and with disclosing tablets so they could see if there was plaque on their teeth and taught them proper brushing techniques. And that, of course, went on my dental school application. So any kind of opportunity like that is always a plus.
Is so you're a general dentist, okay? Practice general dentistry. The other specialties, are those specialties learned education-wise at an institution or on the job? How is it handled? If you want to specialize in orals, if you want to specialize in root canal work, how is that done?
There are programs that you can apply for while you're in dental school, postgraduate of dental school. For example, root canal specialty is, I believe, 2 or 3 years after dental school. Sometimes surgery is 4 or 7 years, depending whether you want to get an MD with the DDS, because some surgeons have an MD degree as well. So it depends. And I know prosthodontics is maybe 2 years, or ortho is maybe 2 years.
Your profession is an ongoing education.
Oh, all the time.
Yes.
Dr. Nasso could speak about that.
Also required to go back for additional schooling?
Yes, to maintain the New York State license, I believe, is it 25 credits a year, 25 hours a year? But we way exceed that because there's always something new. I mean, this is an exciting time. There's not only technology here that we're seeing at Staten Island Tech, but there's technology in dentistry as well. And every day we're using products and techniques that weren't taught to me in dental school. So you really have to stay cutting edge. We belong to organizations that encourage and support continuing education. A couple of years ago, I took an exam, a 7-hour exam, which I hadn't done in quite some time, to get a fellowship in the Academy of General Dentistry. And I had to study and pass this exam, and then I was awarded this fellowship. And I had to take 500 hours of continuing education. I think it was 500. So, and he's a little younger, so he'll be there very soon.
Soon, but yeah, to answer that question as well, dentistry is an amazing field. New materials come out, new science comes out, new technology, and in order to stay, and our practice has done that on the cusp of the cutting edge of technology, you need to take these extra courses, and you need to familiarize yourself with what's out there, because that's what patients want. Patients want technology. They want the newer stuff.
Well, first of all, I don't want to feel pain.
Yeah, it's true.
That's number one.
True.
Okay, so if that technology is going to help along with that. Last week I was talking with an orthopedic surgeon, and I asked him the following question. I'm going to ask you the same question. So, is there a hobby you do that keeps your fingers? I mean, you're working with somebody's wide mouth on the smallest little pieces. I mean, you're creating, you're sculpting, you're an artist. That's my feeling. If there's a tooth that's really falling apart, there's a lot that you're doing to create that. So how do you practice that? Or do you?
That's a good question. I mean,
We have a dear colleague who's a wonderful sculptor, so an oral surgeon on the island.
Sure.
Yes, I have not had time between work and family to develop that kind of hobby, that kind of outlet, so in my retirement I will.
Gotcha.
and I have an 11-month-old, so that's
that keeps you busy. That keeps you busy.
But there are some courses that you can take that you can practice the newer technology, but hands-on. So you can practice any new procedures or with your hands.
So you work with little children.
Mm-hmm.
That has to be, that has to be a difficult task sometimes. Yes, a lot of patience. Your degree in psychology would probably be applied
Perhaps.
to
But the kids today are really so good. I think that a lot of the silly portrayals of dentists in the past have gone out the window, which is a good thing. So kids don't come in with a preconceived notion that it's going to be scary. It's very matter of fact, and as long as the parents treat it like that, the kids come in, they get a ride in the chair, they get a prize when it's all done. And children, for the most part, are very, very cooperative. It's few and far between that we see children that really have a fear. And it's a wonderful opportunity when they have their first visit and they're smiling and they leave happy, and you know that you've made a good dental patient for life, and they won't avoid going to the dentist. Most dental problems occur because patients avoid going. And if you can instill in a young child that this is no big deal, it's not going to be uncomfortable for you, if you can instill that, then you can, really help them along to a lifetime of healthy teeth.
So what's your average day like? It's probably different every day, but what's an average day like in the life of a dentist?
Like you said, every day is different, which keeps it going for us. We don't see, for example, root canal specialists sees root canals all day. So we have different procedures throughout the day. Sometimes it's 8 to 4, sometimes it's 12 to 8. We work on weekends too. So yeah, every day is different.
And every patient is different.
Every patient's different.
Every
sure.
problem is different.
Yeah, and it's challenging. You have your regular schedule, and then somebody calls up with a problem, and we really do our best to see any patient who has pain. We're fortunate because we're a 3-doctor practice, so between the 3 of us, we can we get the patients in. And so that's the challenge. What's the best time to get them in? How are we going to make them comfortable in the time that we have available to us? So I would say sometimes that's the biggest challenge, is how are we going to take care of the patients that we need us, the unexpected that happens in the
There's a
middle of the day.
surprise every day.
Yeah, so that's the challenge.
So we have the dentist. I would say, I guess we could say that they're earning the most in the profession. Yes?
Top of the pyramid.
Top of the pyramid. All right. I should have used that. Okay. So what other careers are related to dentistry?
There's a lot of support that we need in order to be able to provide what our patients need from us. And first and foremost every day is our support staff, our clerical and our clinical support staff. We have certified dental assistants in the practice who are very highly trained, and if apprenticeships were still available like they were 200 years ago, they'd be doing our job. That's very, very knowledgeable and pointing out things to us. It's really a second pair of eyes. So a good assistant is a wonderful thing because sometimes they can see something from their angle that I can't see. Doc, you think that corner's a little sharp? Maybe we should smooth it out. Sometimes she can see it and I can't. It's just a matter of where she's sitting and I'm not. So dental assistants are very, very vital.
And there is formal training for this.
There is formal training. An assistant can choose to become a certified dental assistant, or they can kind of learn on the job. So they still have that,
yes.
right, there's still that option available. The other clinical support that we have, dental hygienists, and they go to a minimum of 2 years of school, and there are certain procedures that they do. They provide the cleanings and do the initial exam charting for us and tell us what they see in the mouth. And that helps us along too. They tell us
they see sometimes more than we do. I mean, they're in there giving cleanings and